Welcome to Episodic Disabilities, Workplace Accommodation and Return to Work, What Employers Need to Know. Thank you for joining us today. This webinar is part of our Harnessing Talent Alliance series. Harnessing Talent, Alliance for Recruiting and Retaining Canadians with Disabilities, is a 3-year project funded by Employment and Social Development Canada. We would like to thank our 9 founding partner organizations as well as our academic team. If you would like to learn more, please visit our website at harnessingtalentalliance.ca and follow us through our Harnessing Talent social media channels. My name is Yusra Benjeloun, Administrative Coordinator and Project Manager with the Work Wellness Institute, and I'll be moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as donations and memberships to WWI. We thank our program partners, Canadian Council on Rehabilitation and Work, Education Advisory Committee, and speakers who contribute to this webinar series. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We will collect questions submitted throughout the presentation and follow it with a Q&A based on the questions submitted. Any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website along with the slides. You will be emailed the direct links for all of these items when they're available. We're very happy to welcome Melissa Egan. Melissa Egan is the coordinator of Episodic Disabilities initiatives at Realize and has worked in the field of health and HIV for over 15 years as an educator and facilitator. Melissa's experience includes frontline work at Youth Co, a peer-led agency working to reduce the impact of stigma related to HIV and hepatitis C. She spent 8 years as regional educator for the Prairies with CATIE, an organization that works to strengthen Canada's response to HIV and hepatitis C by bridging research and practice. Using her training in curriculum development and adult education, she also helped to create online learning courses about HIV and hepatitis C basics and preventing the sexual transmission of HIV, along with webinars on pregnancy and HIV and the realities of young people living with HIV in Canada. She has worked extensively with marginalized LGBTQ and Indigenous people developing and delivering workshops across Canada. Melissa, thank you so much for being here with us today. I'll hand it over to you.
Thank you, Yusra. I am so grateful that everyone is here to be able to join us for this little conversation today. I'm really grateful to Yusra and the folks at the Harnessing Talent Alliance for making this all happen. It's been a really good experience. So, hi everyone, welcome to today's webinar. We are going to be talking about episodic disabilities, workplace accommodation, and return to work. This is a webinar designed for employers. There are lots and lots of resources for employees and people who are living with episodic disabilities on the Realize website. I encourage you to visit it, but this specific webinar is designed for employers. So let's get started. All right, what we're going to be doing today is this, if I can get the slide to go. Here we go. All right. What we're going to do is talk a little bit about the organization I work for called Realize. I will tell you about episodic disabilities and provide you with some examples. We're going to talk a little bit about the employee perspective and what folks who will come to you asking for accommodations and other things related to a disability or an episodic disability, what they might be going through and feeling and that kind of thing. And the other side of it, how you can be a supportive employer, what you might want to have in place and things that you might want to do in order to make sure that the process of accommodating an employee is a little bit smoother and easier.
I'm so sorry, Melissa, to interrupt. I'm so sorry.
Yeah.
You've stopped sharing your screen at the moment, so under sharing,
no.
if you sorry, there you go. Perfect. Thank you very much.
Sorry, everyone.
No problem.
Thank you. All right. We're going to talk about accommodation in specific, so we'll go through that a little bit, what return to work might look like for some folks, and then I have a slide of resources and encourage you to ask any questions at that time or after. So let's talk about Realize. We are a national nonprofit that's been around for nearly 22 years. Our aim has been to foster positive change for people living with HIV and other episodic disabilities. We used to be known as the Canadian Working Group on HIV and Rehabilitation, which is a mouthful, so you don't blame us for changing our name. We have been an innovator for the last 20-something years because we bring together worlds that are usually separate. So we work in HIV, and we work in disability, and we work in rehabilitation, and we try and bring those worlds together to do our work really effectively. What we want to do ultimately is improve the lives of people who are living with episodic disabilities in meaningful ways through direct things like participating in research projects, doing education initiatives like this webinar. I do in-person workshops all over the country, and we also have a couple of online courses that are available for folks to take as well. So we try and do a lot of stuff around education, and through all of that, the research and the education, our hope is to create change, policy change specifically, so that we can in fact have a tangible result of improvement in the lives of people who are living with episodic disabilities. Some of the ways we do our work is through the National Episodic Disability Forum. We are the national secretariat for this group. We are 60 members strong, and we are employers, researchers, academics, people living with episodic disabilities themselves, leaders from organizations, community members. And what we do is come together to try and create change. We promote advocacy, we build awareness, and ultimately what we're trying to do is create a community within the episodic disability space of a whole bunch of people who come from different perspectives and really diverse opinions and feelings, and come together and have a conversation so that we can move towards change. We also create reports and policy briefs to raise awareness. We host policy dialogues and forums about workplace participation. We are partners and participants on research projects. We do active policy work with government representatives and advocacy groups. And one of the online courses that we have is an accredited training for HR professionals to learn about episodic disability and accommodation. Okay, let's talk about episodic disability in specific. Episodic disabilities are characterized by periods of good health, interrupted by periods of illness or disability. Now, depending on the person, these periods vary in severity and length, predictability, and everything can change, not just from one person to another, but within one person's life experience. The conventional view of disability is that it's persistent and unchanging, and that the limitation is kind of always the same. Unpredictability is one of the major kind of components when we talk about episodic disability, and that can have a really negative impact for folks on things like meaningful community participation, employment, income security, social inclusion, and access to care. And employers often struggle with accommodation in the context of an intermittent work capacity, or that variable on again, off again reality of living with an episodic or a dynamic disability. Here are some examples of episodic disabilities. Go down the list. Some of them you might be familiar with. Some of them you really associate with an episodic disability. Others you might not, right? And some people who are living with these conditions identify themselves as a person living with a disability, and other people do not, right? And we are not here to try and put anybody in a box or to restrict anybody's lives or definitions of how they want to think about themselves. But what this does, by us creating a list, however casual and anyway, by creating a list like this, what we do is just give ourselves an opportunity to have conversations with lots of different people who experience lots of different things, to create a reality of what it might mean to be somebody who has intermittent capacity within the context of their lives. Have a look at things like anxiety and depression, schizophrenia, PTSD, these kinds of things, these mental health conditions. There's so much stigma that still surrounds them, so they can be very challenging for people to discuss and disclose, therefore making them quite challenging to accommodate as well. This framework that we use, the Episodic Disability Framework, was created by Dr. Kelly O'Brien. She has done a lot of really great research with our organization, and it uses HIV as an example of how people living with episodic disability might be impacted. I'm going to walk us through it just a little bit. We have a look at that, the left-hand side of the framework there, and it leads with a trigger. You see that down at the bottom, an HIV diagnosis. Now, this could be a diagnosis of any condition, and most often people experience a depression when they are diagnosed with a condition that they know will impact their life in lots of different ways. For some people, stigma goes along with this. When we talk about HIV, stigma is a really big part of what a person is experiencing. But again, if we return to the realities of living with a mental health condition, stigma also exists in that as well. Social supports truly affect the way that someone manages and is impacted by a condition. When people reach out, when there are connections, people's levels of abilities, as you can see, increase, all right? Attitudes and beliefs impact how effective we are at maintaining control. When we have a community and are connected to people who support us, that can make life a lot easier. I think we all know that in how we've all been isolated at home in the last couple of weeks. Connection is incredibly important. But there are also lots of different kinds of triggers. In the context of the slide, an opportunistic infection, a particular kind of infection that impacts people who are living with HIV, it could also be a flare-up if we're talking about somebody with MS or arthritis. Somebody with chronic fatigue may need to take some time off. There might be a significant mental health experience or challenge, and there might need to be time off for that kind of thing. So these triggers, really, you see that decline in level of ability. Aging is one of the pieces of that as well. But in the day-to-day, it is the social supports that kind of build us back up again, those connections that really connect us to people. And for some, actually blocking their condition out of their mind by compartmentalizing things when they're healthy enough to maintain their work and their social connections creates that sense of control over life, over the condition itself. Really, out of this whole framework, the takeaway is to remember that there are constant fluctuations of health and illness for people who are living with episodic disabilities, connections and disconnections, and it really is a reminder of how significant social support can be on the lives of people who are living with episodic disabilities. Excuse me. Here's just a few statistics, just to let you know that there are an increasing number of Canadians who are living with lifelong episodic disabilities. The 2017 Canadian Survey on Disabilities found that of the 6.2 million people who are living with disabilities in the country, about 61% of them experience some type of episodic disability. So if you have a look at those stats down there, about 20% of Canadians will experience an episode of mental illness in their lifetime. About 77,000 Canadians are living with MS, and just about 63,000 people in Canada are living with HIV. So we do have some statistics and numbers on what we're talking about here. We know that episodic disabilities exist and that there are quite a few people who experience them. So what is the impact of that on employment? Why are we here talking about this? Well, have a look at this first bullet point. About 53% of people identified as living with an episodic disability who were working part-time said that their disability or health condition is what prevented them from working more hours. Almost half of people in this particular survey reported that they changed their jobs because of their health condition. People were more likely to do teleworking or flexible work schedules or to be self-employed. People experience significant concerns associated with rejoining the workforce because there are worries about losing things like access to a drug plan or subsidized housing. Even part-time work impacts government support programs, and a few hours a week will have a significant effect on the social support programs that they access. How does this affect employers? Well, in many different ways, and we will get into that a little bit later. But initially, we like to talk about how employers are challenged with balancing communication about accommodation plans and the effect that they might have on the workplace and protecting employee privacy. It's a lot to contend with at the same time. They're also challenged with supporting employee accommodation needs alongside productivity, deliverability, deliverables, and efficiency, all those kinds of things that organizations and companies are often concerned with. One of the things that can be done and that is super helpful for folks is that organizations and companies can develop HR policies and procedures for all staff and communicate those policies effectively. Handing someone a binder on their first day and saying, hey, these are our policies, have a read of them, isn't always the most effective way to get your staff to understand what your policies are and what their rights are. So let's take a deeper dive into how an episodic disability might impact or affect someone at work. This is a couple of quotes from a survey that we did a number of years ago. What the most challenging element of living with an episodic disability is? Well, the unpredictability. I don't consider myself as someone who's ill until I have a flare-up, but when they do occur, they can be quite severe. In the future, having a severe flare-up while employed could pose a challenge, as some flare-ups have lasted up to 6 months. Another person said that the unpredictability of symptoms is the most challenging element of living with an episodic disability. Feeling like I'm letting my coworkers and students down because of fatigue, feeling frustrated because I want to do more with my job, and disappointed because this is not the career I planned to stay in. You can see the way that this type of disability can be life-altering, debilitating, and really, as you see in that first quote, impact identity as well. I don't think of myself as someone who's ill until I have a flare-up, right? So that kind of duality of identity is also really challenging to live with and to contend with on a day-to-day basis. We think about people in the context of work and the employee perspective, remembering that starting a new job can be particularly stressful. There are probationary periods, new procedures to learn, new people to meet, which means navigating disclosure and trying to decide whether or not that's something you want to do. Trying to explain a 2-year absence from the workforce in an interview because of your resume can be really tough. Employees can face a lot of stigma and discrimination when they enter a job if illness has been disclosed at the kind of hiring moment. People need to decide whether to request accommodations and how soon are critical things to try and figure out for some folks. People are really concerned about job security because of the unpredictability of their illness and how that might impact performance. Other people also identify the social impact and stigma of living with a chronic illness as a major source of stress in their lives. Many employees choose to ignore symptoms or work through the pain, hoping that that'll disappear, or perhaps they can just get through one more day. There is a reluctance to ask for accommodations, and there are concerns about privacy and health information. Those can actually exacerbate underlying concerns and lead to a vicious cycle of, wanting to maintain your privacy, but knowing that your performance at work is going down and really getting stuck in that little cycle, which can be very challenging and negative for everyone. The thing that employers, I think it's really important that you know, is that people with episodic disabilities report that they get the most benefit from what might be called soft accommodations. Things like a redesign of the tasks of their job duties, working remotely from home, something that we're all learning how to do right now, modified work hours or days, or even reduced work hours for some people. I would like to do a little poll right now based on this case study. I will have poll questions on the next slide, but I'm just going to read this situation about Renee to you. Renee recently requested an accommodation in his workplace. As a result of the medication Renee takes for HIV, he finds it very difficult to work the night shift. He's requested an accommodation to only work day shifts, and the company HR manager granted that request. But his direct manager still keeps scheduling him for the night shift, only switching him after Renee has pointed out the mistake. This has happened 4 times so far, and Renee is feeling anxious, okay? So here's the poll for you. What could his employer do to improve Renee's experience at work? Well, they could ask him to take sick days or vacation days until he can go back to working on night shifts. Do nothing. Ultimately, Renee is getting the shifts he wants. He just has to ask for it a bunch of different times. 3, Renee, the HR person, and his direct manager could sit down and create a plan. Or there could be an accommodation policy in place that management is familiar with. So select your answer, and we'll see how this goes. Look at that. All right, so 75% of you have selected number 3. Nobody selected answers 1 or 2. And I've got the other 25% of you having selected the last answer. And it's evident that you all know that really the answers are 3 and 4. Really, there should be a comprehensive accommodation policy in place that everyone on your management team is familiar with. And in order to enact that policy, when someone comes to speak to HR or their manager about an accommodation plan, everyone needs to sit down and have a conversation about that so that that person who is trying to advocate for themselves and their health doesn't constantly have to be reminding people of what they need. We can put those meetings in place so there is a formal plan that everyone has agreed to. Thanks for participating, folks. I appreciate that. So let's keep moving. Here we go. Being a supportive employer. One of the things that gets asked a lot when we talk about accommodations is, well, is it like, do I have to? Yeah, you do. There is a duty to accommodate. It is laid out in the Canadian Human Rights Code. It's also laid out in provincial human rights codes as well. When a person with a disability needs supports in order to work, use a service, or access housing, an employer has a duty to provide those supports. However, there are limits to those duties. They're called undue hardship. And when a company is claiming undue hardship, only 3 factors are considered. The cost, whether or not there are outside sources of funding so that they might be able to get outside funding support for the money they might have to spend for that accommodation, and the health and safety of the employer and or place of work. All right, so what does all that mean? Unfortunately, there's no precise legal definition of undue hardship, which is frustrating, absolutely, but it means that each situation needs to be assessed individually because what we're doing is responding to an individual. Considerations like inconvenience or moderate cost or the perceptions and preferences of other employees are not valid reasons for refusing to accommodate. Studies have shown that accommodations often cost less than $500, right? Nothing or very little. And what they can do is save organizations money by retaining skilled employees and by reducing the need for recruitment and training of new staff. We often underestimate how much recruitment and training in fact costs when it might be possible to spend a few $100s and accommodate an existing employee rather than go through all of that other stuff. Right? So accommodation can be honestly the easiest option. One of the biggest things that people are dealing with is the stigma of disclosure, of talking about disability. All of that stuff is really, really challenging. So what can you do in this context? How can you be a safe and supportive employer? Well, primarily demonstrate leadership. Publicly commit to human rights and anti-discrimination policies. Lead by example, right? The way that you behave, the way that you talk to people, the way that you run an organization is going to be the way that an organization lives and exists. Review your current practices and do it regularly. Consider what policies need to be updated to reflect current workplace policies and attitudes. These things change. Have a look at what's the most current and make sure that you're doing those updates. Also consider providing training. Things like anti-oppression and diversity training often address the concept of stigma and particular situations where somebody might be feeling stigmatized. Make sure that those trainings are available to your leadership team, management and employees. And if you are the leader of an organization, attend those trainings. You being there sets a tone. Excuse me. All right. Another thing that you can do is be proactive, right? Create a workplace that is accessible, that is inclusive. What this does is help reduce the need for individual accommodation, and that ultimately benefits everybody, not just people living with a disability. What that means is have a work from home policy in place, right? Make it very clear that yes, people are permitted to work from home up to 20% of the time that they are here. If there is a need to work from home more frequently, then a meeting with their direct manager needs to be in place. These kinds of things. So thinking about a work from home policy for your general staff will in fact benefit the people who are living with disabilities as well. But that kind of universal approach to things can really help to create an environment where people feel safe and trusted. Policies and practices that increase flexibility and accessibility prevent barriers before they occur. They keep businesses running smoothly rather than always being reactive or waiting for an issue to arise in order to address it. Accommodation isn't just the law. It also makes good business sense. It increases employee productivity and can reduce economic loss due to absences or turnover. If somebody needs to stay home for whatever reason, giving them an opportunity to work from home that day rather than having them take a sick day is actually economically better for both of you. So let's think about accommodation. I've been talking around it and blah, blah, blah. So here we are. Accommodation is a way that you can support your employees to work more effectively, overcoming limitations that might be associated with disability. Generally, it is an individual employee's responsibility to disclose an accommodation need to their employer. However, people don't always come forward. So it's important to recognize that individuals with substance dependence or mental health challenges might not recognize or even be able to admit to themselves that there is a problem going on and that they might need accommodation. The duty to start a conversation about accommodation may shift to the employer if they know or ought to know from things that they've seen in their employees' attendance, demeanor, behavior, performance, that they might need some form of accommodation and support. It's important to just keep that in mind, that there may be a rare instance where you might have to discuss with an employee some of the changes that you've seen and gently inquire about whether or not they might need an accommodation for that kind of thing. Generally speaking, people with episodic disabilities generally require different types of accommodations than those who are living with long-term physical disabilities. The types of accommodations might be time off to attend medical appointments or to adjust to the side effects of a new medication, a flexible work schedule, or the ability to change a shift so that employees can adjust a work day or a work week to accommodate health needs, treatment needs, these kinds of things. That flexibility is really important. Other accommodations might be reassignment to work that's more aligned with their abilities, something that is more, something that's less physically demanding, or something that's less mentally demanding, something where someone interacts with the public less frequently. These kinds of things, being open to understanding what a person brings to the work rather than just the limited bulleted list of their duties on their job description. There might be a need to shift from full-time work to part-time work, or using loo time, or even working a compressed work week so that somebody is only in the office for 4 days, but their days are a bit longer. Somebody might require a space to rest during the workday in order to combat fatigue or even take medication. They might need access to a refrigerator to store their meds, and maybe even there might be cases of job sharing. Some of the things that you might encounter when working to accommodate episodic impairments or disabilities are unpredictability, right? We learned a little bit about that from those quotes that I pulled out earlier. The length of an illness, so how long someone has been ill with their particular condition. The stigma that surrounds that condition, and what that might do to their social supports and the way that they feel about disclosure. The ongoing need to disclose. Disclosure often happens when there are changes in organizational structures or management. Really think about accommodation plans that are in place when you are doing new hiring for new management, that kind of thing, and ways that you can ensure that that manager is aware of what is happening with that employee before they start the job, so that they can go into that interaction with the employee with an understanding of the accommodation plan. There might be invisible symptoms, and those symptoms might be frequent. Just remembering, that everybody's fighting a battle, and they interact in the world, and they navigate the world, and we all just need to be gentle with each other and really remember that we're all going through some stuff. Access to medication and treatment can be very critical for people who are living with disabilities, and there is a great deal of importance for them to maintain health benefits and a regular income. So accommodation may be something that will be really helpful and significant for them in their lives. There may also be the presence of other conditions, right? People tend not to just live with one. As they get older especially, there might be coexisting conditions as well. There is an ongoing need for documentation to substantiate accommodation requests, so those need to be something that people will need to get for you in order to enact some of the plans, but that's a part of working to negotiate accommodation. You might also need to remember that accommodation plans have to be nimble and flexible, because if there's a flare-up, there might be a need to renegotiate or just create a whole new plan because of their new reality. And it is important to also navigate the attitudes of coworkers to accommodations. There may be a feeling that things aren't fair, or somebody is, and I'm using air quotes here, getting stuff that other people aren't getting. Managing feelings about accommodation and what equity is often a very good idea in these contexts, so that folks understand that we all need different things to be successful. We're not all going to get to the same place using exactly the same things. Some of the best practices for accommodation include flex time, a private space to take meds, maybe more frequent breaks, a private space to rest. Now, I'm not talking about like a bedroom or a sleeping bag under their desk. I'm just talking about perhaps giving your employee permission to book a meeting room for a small period of time during the course of their day so that they can privately rest if they need to. Some adaptive technologies, peer supports, part-time work, but with full-time benefits. There are a number of organizations and companies who do this. Many don't, however. Part-time work with prorated benefits, so a slightly smaller benefit package. In order to get a little bit more information about this or any other accommodations, occupational therapists are a great resource. There's also a place called the Job Accommodation Network. Their website is comprehensive, and I suggest a visit there as well. Accommodation is a fundamental and integral part of the right to equal treatment, and what that includes is dignity, all right? Maintaining someone's privacy, confidentiality, comfort, and autonomy, all right? Individualization. We all have unique needs. There is no one-size-fits-all accommodation, right? And that's where we get back to that notion of equity and remembering that we're all not going to get to the same place using the same equipment. We all need different things to get us there. And inclusion, right? Remove barriers that prevent the full participation and integration of a diversity of people into your organization. That kind of diversity really feeds organizations and gives them much greater awareness and understanding of all kinds of people. And that really helps a business grow and move along. All right, returning to work. Let's think about returning to work. So how can you support this? Really, I've said it again, I've said it over and over again. Here we go, standard policies, all right? Really think about your HR policies. Have a look at that manual and make sure that there are return to work policies and procedures in place that apply to all employees, that everyone has access to. Return to work meetings with HR to establish accommodation plans for individual employees when they indicate that it's time for them to return. Perhaps they've been on a short-term disability or long-term disability. These meetings need to be there to ensure a safety and a trust for that employee so that when they come back to work, they know how things are going to be. Returning to work after a long absence can be very challenging for people. It's also great to have informal discussions with managers and between managers and coworkers about accommodations and about what that means and what people might need and how that might look on a day-to-day basis at your place of work. So how do you make returning to work work? Have a plan, right? Document things, make them specific. It's really great to have a date for reassessment, right? Maybe 6 to 8 weeks from the time that that person returned to work to be able to say, okay, how are you doing? You've only been working 3 days for the last 6 weeks. Are you ready to go up to 5 days a week now, or do we need 4 days a week for 2 weeks? These kinds of things. Having those conversations with somebody really creates that specific plan so that everyone's on the same page. Remember to consider accommodations like job modifications. Do we need to remove this task perhaps and add that one instead? Flex time. If you're in pain, you need to work from home, that's fine. You can work from home in the mornings and then come into work in the afternoons. These kinds of things. Maybe even changes to a physical workspace. Maybe somebody was sharing an office, but they would be actually better when they were out in a cubicle with a whole bunch of other people. That kind of bigger space, but private desk might be what they need. Stay flexible. This is huge. A plan might need to be revised. Everybody's going to be adjusting to a new way of working with that person and a new way of understanding. Staying flexible is key to be able to making it work. And lastly, communicate. Talk to everyone. People need to know what's going on and simultaneously maintain that confidentiality. So you're finding a balance there, but experienced managers have been doing this for years. You know how. And then remember to check in with that returning employee, especially at that direct manager level. Having those daily or weekly check-ins is really important, making sure that they know where you're at and how they're doing. Accommodation planning, accommodation plans for returning to work are trial and error. They require commitment and engagement from both the employer and the employee, right? Remembering those regular check-ins is the responsibility of everyone. Employees will also need to have resources outside of the workplace. So emotional support and community support, maybe that's something that's provided through a benefit plan, making sure that employee knows that EAP is available or that there's coverage for therapy or social work of some kind. Accommodation plans and returning to work also includes how to complete work if there are absences due to illness. Is there someone who is available or ready to step in and support? Is there a plan to have somebody work from home when they're experiencing their illness? How long? does that happen for? All of these kinds of things. Getting really specific is what will help both you and the employee transition back into work and continue to work successfully while they're out there, and continue to make sure that things carry on as they should if somebody is in fact at home. Remembering that episodic disabilities vary over time is really important, and this year's accommodation plan may not work next year. There might be concurrent conditions, so again, some accommodations that were effective at one point might not be effective at another point because it's in fact another condition that they're dealing with. Accommodation and accommodation planning, returning to work, all of this stuff requires long-term perspective. You need to be flexible, you need to be open to reassessment, and there needs to be a spirit of collaboration going into this. There are so many resources available online to create return to work plans and accommodation plans. The Ontario Human Rights Commission has one, the Canadian Human Rights Commission has one, and the ACE project, Realize is a partner on the ACE project. They will soon be releasing their tool for episodic disability accommodation. So yeah, sign up for their mailing list and you will learn all about the JDAPT tool when it's launched. I'm very excited about this one. So just before I begin to wrap up, I wanted to include a little bit about returning to work after what we're all experiencing, because I think that for me, and probably for you, this time has created a huge shift in the way that you're working. What you may see is an increased demand for regular, ongoing work from home from employees. The demand for flexibility and where and how people work has been building for decades. But before this particular crisis, surveys repeatedly showed that 80% of employees want to work from home at least some of the time. Over a third of employees in a study that I read said that they would take a pay cut in exchange for the option of working from home, right? This is something people really want. And there have been many employers that have not been open to it. Unfortunately, now the genie's out of the bottle, as it were, and people have had to adjust to the fact that working from home can work. There is an increased need for trust and consideration from employers, all right? We need to trust the people that work for us. One of the biggest holdbacks is trust. Managers don't trust people to work untethered. They're used to managing by counting butts in seats rather than by results. Unfortunately, that's babysitting. That's not management. So if someone says, well, how do I know if they're working when they're working from home? And well, the question might actually be, how do you know that they're working now, right? Employees will prove and have proven over the last few weeks their competence for working remotely. And that understanding may affect the way that they think about workplaces. They might grow less tolerant of places that don't promote health, work-life balance, overall well-being. People can work from home, and you may see an increased demand for it after this particular experience. This is another thing that if you accommodate all of your staff, you will in fact be creating greater opportunity and accommodation for people who are living with episodic disabilities while you do it. Just wrapping up here, this is the resource page I've referred to a couple of times, the Canadian Human Rights Commission Workplace Accommodation Plan template, the JDAPT tool from the ACE project. Arthritis Canada has great resources for employees and employers. Those can be found on their website. The MS Society has an employer's guide as well. And Realize, the organization I work for, has a report called A Win-Win Proposition, the business case for actively recruiting and retaining people with episodic disabilities, that I encourage everyone to have a look at. I am going to put my camera on so that we can have a little chat and you can see my face. See if we can make this happen here.
Thank you so much, Melissa, for this excellent webinar. Perfect. Hello. So if you don't mind, we'll move on to the Q&A session right away. To our attendees, if you have any questions, please input them in the question box. So I find it extremely interesting that you have described the employee's perspective dealing with disability, which is very important for employers to understand in order to be able to support, help, and or accommodate their employees. So that brings it to the first question. What would you recommend for an employer to do in order to have a more comprehensive understanding of the employee perspective?
I think one thing that you can do first off is do some reading and some research, right? Because what we're talking about is generally confidential health information. Having an understanding of what a general kind of people with episodic disabilities might be experiencing, read through the Realize website. You can email me. My email's at the end of this presentation. I happily hand it out. But that's really a big part of it. Increase your own knowledge rather than depending on the person who is impacted by an episodic disability to do all of that education for you.
Perfect, thank you. So the second question is, how can employers better identify the areas of improvement in terms of their practices and policies?
Making sure that your policies reflect current legislation, right? The Accessible Canada Act came out last summer, all right? It's brand new. Have a look through that, right? There is a comprehensive document online. Read it. Make sure that what is in legislation now about disability is reflected in your policy. This is something that is the responsibility largely of folks who do HR. Small organizations often don't have HR, so maybe there's an employee that you've got who might be interested in something like policy. Some folks are really into it. And get them to read a few things and see if that is reflected in your existing policies, because things change quite rapidly and language has been shifting, rights and awareness has been shifting. So this is about ensuring that you have a place to find that information. So current legislation, the Canadian Human Rights Commission is a good place as well. Provincial human rights commissions also reflect all of these kinds of things. So having a look at things at a national level first and then getting down to that provincial level might be a very helpful way to get what you need.
Thank you, Melissa. Our next question is, one of our audience members says that health benefits are often insufficient for employees to access appropriate care, plus access to treatment, especially mental health conditions, are not easy. So in this case, Melissa, what would you recommend for an employee to do? Should they mention it to their employer? Is there anywhere they could turn to obtain additional support?
This is a very challenging question, and it's true. One of the things that has been happening in the last little while is a college, like a, what do they call them? Similar to the College of Physicians and Surgeons. I'm not sure what, like a body of overseeing how things work. Anyway, psychotherapists are traditionally not covered by benefits. However, they have recently acquired a college of psychotherapists. And that means that they are regulated. That's the word I'm looking for, a regulatory body. Having language in a benefit plan that makes it possible for people to see a psychotherapist and not just a psychiatrist or a psychologist or a social worker expands their access to mental health supports. And psychotherapists are often less expensive than a psychologist or a psychotherapist, making the money within a benefit package, which can often be $500 a year for mental health supports. Well, that most of the time in a city like Toronto, where I live, is less than 5 appointments, right? A therapy appointment costs over $100 these days. So that kind of thing for employers especially is one thing that you can do, is really explore if there is a way to increase not necessarily the coverage, but just who people can access rather than limiting that coverage. For employees, honestly, for everyone, accessing mental health, especially mental health support services, especially when money, as it is for everyone, when money is a factor. There are often places where you can go to access less expensive or free or geared to income mental health supports. However, they often have long waiting lists. This is a standard and frustratingly standard thing that many people in Canada struggle with. And honestly, I don't have a solution for it. It's rough.
Understandable. Thank you, Melissa. Our next question is, do you have an idea about the frequency, or is there a suggested time frame for reassessment in order for accommodations to be successful?
I don't have like data that I can quote for you, but in the research that I have done, in the things that I have read, what is recommended is about 6 to 8 weeks. I would err on the shorter side of that myself, because at a 6-week mark, there's enough time for people to have been in lots of different states, have accessed and had to do a lot of the different parts of their job. So, but it hasn't gotten to the point where 8 weeks down the road, there are some things that are falling down, or people are developing workarounds or not doing certain things, and tasks are being dropped or forgotten. So that 6 to 8 week mark, I would err on the side of 6 weeks, just so that there is, it's still fresh enough that you're like, okay, so we talked about this last month or just a few weeks ago, and we can reassess this, so that so that nobody feels left out in the cold, right? So that frequent check-in is a way to make sure if there is a reassessment or if there is a need for something to change, it can be done in time enough so that nobody's feeling put out, or that there's not enough done, or that nobody's communicating. Does that make sense?
Yes, thank you. The next question is, does a request by an employee for accommodations always need to be validated by a third party, such as a healthcare professional, for example, a physician, occupational therapist, etc., who is qualified to do that?
Not all accommodations will need to be validated by like a health professional if you don't need it to be, right? If you go to your manager or if the manager has an employee come to them that says, hey, I'm struggling and I'm wondering if I can work 4 days a week for the next 3 months in order to just get my head on straight a little bit. And if they're open to it, that employer can say, sure, absolutely, you can do that. That's something that as an employer, we are open to you doing. You don't need to disclose what's going on. It'll be a 20% pay cut for you, but if that's okay for you, that's okay for you, right? Instances where you might want to get a health professional's validation is when somebody is seeking benefits, full-time benefits with part-time work, that kind of thing. Generally speaking, in my experience, only physicians are qualified to do that kind of thing. Sometimes occupational therapists also, but generally, when people are dealing with physical health conditions, mental health conditions, it's a psychiatrist, a psychologist, a doctor. Okay. I have heard of somebody bringing medical documentation from a nurse practitioner that was not accepted. Okay, so generally it's, when you're talking about gatekeepers, we're talking about physicians, psychiatrists, psychologists, right? It can be really a big struggle to get that medical documentation, because often these things cost money, right? People ask for X amount of dollars for a medical note, X amount of dollars for a report, these kinds of things. So that needs to be something that's considered by an employer when they're asking for those types of things as well.
Makes sense. Thank you very much, Melissa. Another question is, what do you do if management or HR is not receptive to requesting accommodations?
Whew. Well, it's it's a legal right, so you do have places to go, okay? Provincial human rights commissions, the Canadian human rights commissions, ombudsman if you're working at a university or in the city, these kinds of things. It's something that I would consider taking it a bit higher, right? If your manager says no or HR is not receptive, then ask for a meeting with your, CEO or your executive director, these kinds of things. This is part of the law, so it's something that needs to be done. However, I've seen people being shunted back and forth between two different offices, right? So human resources and health and wellness, and trying to find accommodation when nobody wants to take responsibility for it and they keep getting shunted back and forth. These things are difficult, and often people are unfamiliar with what an accommodation might look like. And so they respond no immediately because they think it's going to cost thousands, there might need to be this, and you'll never come to work again, all of this stuff. Sometimes that conversation could be prefaced with, I need an accommodation, this is what I need, right? Rather than leading with, I need an accommodation and we have to talk about it. If a person who is living with an episodic disability knows that they might need to reduce their work hours for this amount of time, go with that. Have something to suggest that might help to decrease some of the initial fear response or, oh my God, it's going to cost so much response that you could get from an employer.
Thank you for answering this tough question. Our next question is, at what point in the interview process or job offer does one need to disclose? And can a job offer be rescinded after disclosing accessibility needs?
My suggestion with this is to disclose as much as you need in an interview in order to be accommodated for that interview, right? People who live with anxiety disorders can email somebody that said, hey, you've got an interview, we'd love to meet you. You can say, that's wonderful. If possible, would you please send me the questions for the interview in advance in order for me to prepare more effectively and to manage my anxiety? It's important to remember that when you're not an employee, it's not required for people to maintain your confidentiality. So keeping that in mind when you're thinking about disclosure in an interview context. I am not a lawyer and don't have legal experience, so unfortunately, I don't know if a job offer can be rescinded after disclosing accessibility needs officially. My understanding is that if you were hired for a job in the service industry where you were going to be a waiter and as a server, you need to be there, and when you got hired, you said, unfortunately, I need to work from home, we can't be a waiter from home. So in that moment, a job offer could be rescinded, right? So it's about matching up those types of things. Does the accommodation, is it still possible to do the job and the requirements of the job if there is an accommodation in place, right? Doing that little equation for yourself when you're thinking about disclosure is one that might be helpful for you to get a sense of how things might look.
Perfect. Thank you so much. And I think we'll arrive at our last question. So the last question is, do you have any resources of how novel micro-credential and badging courses or programs accommodate students and or working professionals? Because a lot of people are considering certifications to pivot or kickstart their careers. However, persons with disabilities may need accommodations which may or may not be in place.
Realize recently developed a course for academic instructors, right? So folks who teach in a university context, and it's all about universal design for learning and accommodation practices within that very specific context. Now, we hope to expand some of that stuff, but I strongly suggest the person who asked this question to send me an email in specific, and I can be a little bit more helpful.
Perfect. Thank you so much, Melissa. Excellent
Yeah.
webinar, really. And that's the feel of our audience as well. I received a lot of comments stipulating that. So thank you.
Thanks so much.
Yeah, thank you for making the time to define episodic disabilities and the impact they have on people's lives, and also for showing how employers can accommodate employees with episodic disabilities, and for providing a list of tools and resources that would help support the return to work. I would just like to remind our audience that the recording of this webinar and slides will be posted on our website, and that you will be receiving an email notification when these items are available. We had an extremely strong interest in your slides. So thank you all for your continued support and growing interest in our webinars, especially during those difficult times. So stay safe. Immediately following the webinar, you will be directed to the evaluation survey. We greatly appreciate your input on our webinars as well as suggestions for future topic areas. All of our webinars are created for public access and supported by voluntary donations and memberships. Thank you again for your participation, and thank you immensely, Melissa. Have a wonderful day. Bye-bye.
Thank you, Yusra. Thanks, everyone. Take care. Bye-bye.